good morning, good afternoon, and good evening, everyone. Welcome to another week of Global Cafe. My name is Mitali Mistry, Senior Policy and Project Coordinator here at the IFA. And today I'm very excited to be introducing you all to Dr. Alexandra Lopes on the topic of European policies and practices for older adults in long-term care. Alexandra Lopes is a professor of sociology at the University of Porto, Portugal. She holds a PhD in social policy from the London School of Economics with a thesis on welfare arrangements in social care in family-oriented countries. Her research interests are primarily focused on long-term care and care arrangements, drawing on the analytical frameworks of person-centered care, autonomous and independent living, and social inclusion and participation. She has authored several publications and involved in several research projects related to these topics. Between 2015 and 2018, Alexandra was part of the sprint team that looked at the European long-term care landscape and developed some guidelines to assist stakeholders making decisions about long-term care practices and policies. Drawing on the principles of social investment, Sprint has developed a toolkit that interested parties can use to evaluate the social return on investment of different approaches to long-term care. More recently, she engaged in Let's Care, another EU-funded research project launched on April 1st, 2024, that aims at identifying and studying effective and replicable solutions in the field of long-term care. In the aftermath of the publication of the European Union Care Strategy, this new research project is focused on making a positive contribution to advancing long-term care policies and practices towards greater equality, inclusive growth, resilience, and societal well-being. Alexandra is also involved in teaching and currently serves as director of the Iberian PhD program in social sciences and aging. So thank you so much for joining us today, Dr. Lopes.
Hi, good morning, good afternoon, and good evening. Thank you, Mitali, for the introduction, and thank you so much for the invitation. It's great that you have decided to organize a session on this topic, which is definitely something that is at the forefront of the political debate nowadays in Europe. So it is a pleasure to be here with you.
It's our pleasure to have you. Just to start our conversation, I was wondering if it was possible, if you could start us off by explaining, what led you into this current work that you do, and what has been your source of inspiration along the way?
I think that I think my interest in this topic of long-term care started off in the mid-90s. It was a time that in Europe was very much marked by discussions about the way forward for the welfare state that was seen as being under pressure. And this pressure was explained by a series of factors, but the aging of the population was commonly identified as one of those sources of pressure. Yet, discussions by then were very much focused on the sustainability of pension systems and labor market dynamics. Care provision, care arrangements, they were left out. So I think this is where my interest in studying long-term care systems and policies comes from the original lack of visibility of the topic, something that was even more so in countries like my own, with a long tradition of care provision inside the families. In most countries of the world, and this includes Europe as well, of course, care for older persons has been historically seen as a family responsibility. And by family, if we are to be very honest, we mean women's responsibility. But yet the signs that the social sustainability of these arrangements were at risk, the signs for me were already quite clear 30 years ago. But by then, with little to no responses from the public policy side. So this is where it all started for me, and I ended up, like you said in the introduction, submitting a PhD thesis that discussed precisely the social sustainability of family-based care arrangements in contemporary Europe, and I never left the topic till today. And to be very honest, I still remain quite passionate about it, mostly because I still feel that there is a lot to do if we are to secure equitable access to high quality and affordable care to all persons that need it. There are still too many people with no access to the care they need. There are still huge issues concerning the low quality of some of the care being provided. Care work is not socially recognized. So there's so much to do that I feel the job is still not finished. So here I am, and I guess that's why we are having this session today as well, right?
Absolutely. And, I love to hear that you're still passionate about this work and things like, for example, the COVID-19 pandemic, it kind of exposed a lot of the gaps that are happening in
Yep.
long-term care across the world, in Europe as well. And so I think it's amazing to have individuals like yourself, continuing to do the work to kind of close these gaps and bring all these things
Mm,
to light so we can really improve the care of
absolutely.
people.
Yep, absolutely. Yep. Yep.
And so the concept of long-term care, it has different implications in different regions. I was wondering if you could speak to the diversity of care that can be provided through what's known as long-term care, such as,
Mm,
for example, the dichotomy between healthcare and social care.
mm. Yeah, I mean, you're quite right. I mean, there's no single uh, internationally accepted and standardized definition of what long-term care is. And um, maybe the one aspect in this expression that is more consensual relates to the long-term care part. In other words, we are talking about the type of care that is provided over a prolonged period of time, in some cases forever. And as a result of a long-standing condition that requires the person affected to get support. But where there is more difficulty is in the care part of the definition. So what is care? And indeed, like you said in your question, the term means different things in different countries, which also leads, for example, in huge variations in how data is collected. Sometimes it's quite challenging to do research about this topic precisely because of these variations in what is understood by long-term care that lead to variations in how data is collected, for example. Long-term care in some countries is only health care. In others, it is social care. In others, it's both. Going back to the issue of data, for example, when you try to get data on the size of the long-term care workforce, looking at international data sets, you see huge variation. And although part of that variation obviously is reflecting differences in the amount of long-term care provision available in each country, it also at least partially reflects differences in how long-term care is defined and, for example, what a long-term care worker means. In some countries, this only includes nurses and other healthcare professionals. In other countries, it includes social workers, staff working in social care services. So, quite a lot of different ways to approach it. But there are other aspects of diversity that also make it challenging to set the boundaries of what is and what is not long-term care. Long-term care can be provided in very different settings, inside institutions like healthcare facilities, nursing homes, in daycare services, such as daycare centers, but it can also be provided in the home of the care recipient, like in home health services, community healthcare services. And here we are only talking about settings where care is provided by professional carers, because you also have long-term care provided informally by relatives, friends, neighbors, the so-called informal carers, again, sometimes in the home of the care recipient, sometimes in the home of the care of the caregiver. And then you have, for example, the case of migrant care workers, often employed to work inside the home of the care recipients, so many times in a situation that is not entirely clear from a legal perspective, but for example, where it is very common to have a mix of personal care with non-care work, such as domestic work. So the long-term care can mean quite different things in terms of the content of the care involved. Sometimes it's very intensive. in situations of very severe dependency, with very complex combinations of personal care and health care, but it can also be a less complex setting and involve support in instrumental activities of daily living that can be as light as just taking care of the shopping, for example. So it's tough to define it, and let me just finish by adding a bit to the complexity, because if you really want to capture the complexity, one can also ask, and what about long-term care in cash? Because so far I've just talked about long-term care as direct service provision, but you also have cash for care benefits in some countries, carers allowances in others. Are these part of long-term care? Some would argue yes, others maybe not so much. So it's a complex concept with meanings very much related to national cultures, national experiences, to models of welfare state organization. So it's something that sometimes challenging to discuss in this broad manner, even looking at a specific region such as Europe. Even inside Europe, you really have a very complex landscape.
Absolutely. I think you did a beautiful job of explaining such a complex, term to all of us and kind of focusing on the, the long part of that, the extended care, as well as the care section and how it can be divided and within contexts, that, there can be differences and it's important to
Mm-hmm.
understand that these differences kind of flow, country to country, region to region.
Yep.
And that will change time to time, the policies that are
Oh, for sure.
involved. Even within Canada, where we're located, the term long-term care has different meanings province to province. So it's always, it's always important to keep that at the forefront when kind of
Yep,
discussing that. Absolutely.
definitely.
So I was wondering if you could now describe the link between aging populations and long-term care, in addition to the misconception that long-term care is only for older adults.
Yeah, sure. I mean, the aging of the population and all it involves, all it entails. Uh, um, let's be clear, it does put pressure on long-term care systems. So we know that the population is living longer, and that alone increases the chances of any of us needing some care at some stage of our life, of our old age. I mean, we know that the prevalence rates of disabilities potentially giving rise to long-term care needs significantly increase with age, and that especially high among the very old, so those aged 80 or more. So, I, I mean, I would say that it's understandable that long-term care is often primarily discussed in association with the aging of the population, since it is the aging of the population that accounts for the lion's share of the growth in the demand for long-term care. It's not easy to give you numbers about this, but for example, if we look at some estimates based on data from the European Union Survey on Income and Living Conditions, which also collects data on self-reported needs for care. And the last numbers I have, which are for 2019, but I'm sure things have not changed that much. And if they did, it would be to to in the negative direction. But as I was saying, the data points to an average of slightly more than 1 in 4 individuals aged 65 plus and living in a private household needing some type of care. This is obviously data for the entire space of the European Union. There are variations across countries, but let's not go into those details. But so so overall, yes, there is a strong association between the aging of the population and the increasing needs for long-term care, not just in terms of quantity, but also in terms of complexity. which is also an important point. Just recently, I was discussing with some colleagues some changes that we have been seeing, for example, when looking at residents in nursing homes nowadays. We see that over the years there has been a change in their characteristics. People are going to nursing homes at a later stage, often with comorbidities. We have increasing numbers of persons with some type of dementia. So we have not only an increase in the demand in terms of quantity, but we also have a more complex scenario as a direct result of the aging of the population. And the agenda of healthy aging here is extraordinarily important because definitely we are living longer, but we need to live healthier, and that alone would help contain this rise in demand. But again, your question conceptually is also correct, because when you mention that there is this misconception that long-term care is just for older persons, you're right. It is not. Let's think, for example, about disability and about the care needs of persons that, due to their disability, need support in different aspects of their daily life, and therefore they need long-term care. And these can be persons of all ages. But again, I think there is no way of denying the link with old age, especially because when you then start looking at what happens in different countries and how they have organized their national care systems, age is often a criterion used to establish or to define the types of services. It is used as an eligibility criterion for assessing, for having access to certain types of services, and even the labeling of services. You call nursing homes institutional care for persons above a certain age, but you use a different name, for example, to institutional care for persons with disabilities. And typically you do not mix these age groups in the menu of services. So, and even when age is not a criterion, when you have a high number of persons effectively using a service, and that they are above a certain age threshold, that also ends up influencing the way services operate. So it's almost like a natural adaptation to the profile of the predominant users. I'm not sure if I answered fully to your question, but I think this is why when we look at ongoing debates about long-term care, it's the reality of facts. Predominantly older persons using long-term care, and so they end up being placed at the center of the debate, I guess.
Absolutely. No, I think you answered that question perfectly. It's important to understand, why that kind of thought process is there, and the fact that, they are an important population that is considered for that. So absolutely, thank you for kind of going through that with us. So what are some of the challenges ahead in implementing policies across the EU region, with member states arranging for that, high quality and affordable access to long-term care? Care in long-term care.
Hmm. Well, that would lead us probably to a very, very long, very long discussion. So let me just try to organize some thoughts and
For sure.
summarize some
Mhm.
key points. So I think that there is agreement about the fact that there are gaps in
Yeah.
care provision, with many people remaining underserved, with no access to adequate and affordable care. So this is the starting point. And it's also a fact that in many countries of Europe, formal long-term care has never been a priority,
Mm.
which translates, for example, in underinvestments in terms of allocation of public resources and funding. In the EU alone, again, figures for 2019, you had roughly half of the member states with public funding of long-term care below 1% of the GDP, when the average in the region was 1.7%. So basically, we need to expand long-term care coverage, securing it's affordable and simultaneously of high quality. So what are the challenges to achieve this? I would probably highlight three main ideas, especially because they reflect common challenges to all countries in the European region. Now, first, you cannot provide care without sufficient and qualified workers. Okay, so you need workers. And there are shortages of care workers and even more of qualified care workers. And this is a very complex issue. In 2020, the European Commission estimated that there were more than 6 million people working in long-term care, which represented roughly 3% of the EU's entire workforce. Now, it's a workforce that is predominantly females. Around 90% of formal care workers are females. The work they do is hard, physically, emotionally. Working hours are very tough. Care is often a 24/7 type of work, involving shifts, working in the night, working on weekends. And then salaries are low, in many countries at the level of the minimum wage. So we are talking about a type of work that is not attractive, and moreover, that is not socially recognized and valued. Not surprisingly, long-term care work in Europe is becoming increasingly dependent of migrant care workers, which is something that we need to acknowledge and give due attention, because often these workers are subjected to even harder working conditions, especially when they are privately hired and work at the home of those receiving care. On the other hand, their ability to secure good quality care is often overlooked. For example, we have reports of migrant workers not speaking the language of the service users, which creates barriers that may hurt the quality of the care being provided.
Absolutely.
And we also have to look at the impact. We need to look at what the reliance on migrant care workers means on a more global scale, because keep in mind that when some region of the world, like Europe, this is what is happening now, facilitates the inflow of migrant care workers, it is altering the balance of social care systems in the countries of origin of those workers. So it's almost as if we have a care drain phenomenon in some regions of the world, which are typically the poorest. So this is a domain of challenges that the care work and the care workers challenge. The second challenge I would highlight has to do with what we have been already discussing, guaranteeing that care is organized in a way that is affordable and where access is not dependent on one's economic situation or where one lives. And when you do not have enough public care provision, you increase the risk of income-based inequalities in access, since the purchase power of each individual and each family will determine if you can indeed tackle your needs or not. And I think we all agree this is not what. So expansion of long-term care must take into account the need to secure equitable access, and nowadays we have quite a lot of reasons to be concerned about this issue. This relates to how we define eligibility. There is variation across Europe on this matter. You have countries where access to care is a right, but you have many, majority, where long-term care is not defined legally as a right. This also relates to funding models. Countries organize differently the funding of long-term care, which leads to more or less generous solutions that are more likely or less likely to have impacts in terms of inequalities, leaving some out. And we also need to keep present the topic of territorial inequalities in access to long-term care. It's also challenging aspect of securing equitable access. The evidence across Europe suggests that coverage rates, for example, in rural areas and low density areas, are lower than the ones in urban areas, especially for home-based and community-based care services. And interestingly enough, these rural areas are often the ones where you have higher aging rates, so a lower availability of informal carers, which ends up aggravating the effects of the lower coverage of formal services. So in a nutshell, the challenge here would be to secure funding for long-term care to guarantee equitable access, obviously keeping in mind fiscal sustainability. We are all aware that resources are limited, and in some countries where the starting point is quite low, I mean, the effort required to achieve this will be quite demanding, but it's something we need to consider. And maybe to finish, the third challenge I would highlight concerns the need to have high quality of care. The European Social Pillar puts a great emphasis on the topic of quality, the European strategy for care as well. Of course, that if you don't have adequate funding and if you have staff shortages, obviously quality will be at risk. So we separate these challenges, but we are aware that they are interconnected. But on the specific topic of quality, and although there is consensus that quality is important, there is no consensus about what quality means and about how one can measure qualities. I mean, many countries do not have quality assessment. Others do, but most of them are focused on accreditation procedures, others on aspects of daily operations. Very few involve an outcomes-based approach. And sometimes even inside the same country, we are talking about these things in a very general way, but in many countries, long-term care is a domain that is highly decentralized in terms of the national organization of funding and the provision of care. So sometimes even inside the same country, you find a diversity of understandings and practices in issues concerning quality. There are ongoing discussions in Europe about the need to develop some common quality framework that can guide member states introducing some reforms in their national systems. One interesting approach from my perspective will be the implementation of indicators of long-term care as part of the regular statistical monitoring of the EU, which is something that is also mentioned in the strategy. But on this, and because there are people hearing us from outside the EU region, just a clarification, long-term care is a policy field over which the European Commission has no jurisdiction. It is entirely a matter of national policy. So the only way to influence national develops and foster some convergence, let's put it this way, is to issue recommendations, to set guidelines, frameworks of reference, to implicate states in declarations of rights, in strategies. So using this kind of soft policy mechanisms. But we can achieve a lot with that as well. So care workers, funding to secure equitable access, and quality, for me, are three of the core challenges at the table.
Yeah, absolutely. And thank you for kind of bringing back those points. That's, those are quite big challenges to overcome. But, I hope with, continued work that's ongoing across different countries in the EU as well as around the world, I'm hoping that it kind of pushes for, kind of cohesive change towards making quality, the care just better for
Yep.
these individuals. And
Yep.
I also like that the implementation of the different solutions that you spoke about as well, that, hopefully you mentioned soft policy, but anything can, at this point, if you move it forward, could be very, very useful.
Yep.
Amazing. So I would also like to open up the floor to our participants today. So if you have a question or a comment, please pose it in the chat and we're going to start going through those as well. I'm just going to make my way over to the beginning of the chat here. We have a question here from Shmuel, who asks, in your opinion, speaking to the experience of the European policies and practices, how can we support improvement in long-term care for older adults that are coming specifically from, maybe a lower middle income socioeconomic status?
Yeah, I mean, this relates to what we were discussing just now. The important idea to keep in mind, I would say, that is the mission, is to find balanced solutions that, while securing good quality of care, are affordable, so that you don't leave anyone out. And that's why we insist a lot on embracing the discussion about long-term care, as it needs to be seen as a national matter and as an issue of fundamental rights. So I would emphasize again the need to move forward with the agenda of rights when we talk about long-term care. Inspiration in what has happened in recent years in the field of disability could be a good way to start, because after the publication and the ratification by the vast majority of countries around the world, but definitely in countries, of the Declaration of Rights of Persons with Disabilities. So when you start talking about rights and not just looking at these needs, or at satisfying these needs as a matter of social assistance, in many countries, this is still very much discussed from the perspective almost of a charitable approach. So moving ahead with an agenda of rights, for me, is absolutely fundamental, because when you establish that an individual has the right to long-term care in a situation of need, obviously, that creates the force, the mandatory force to implement care solutions. And I think this is the best way to start addressing issues of inequality. But again, like I said, without appropriate public funding, this is not possible. Okay, now we may need to be creative on this issue. Okay, and looking at what has been happening across the EU, the European Union. We see that some countries are already trying to innovate in terms of the mechanisms of funding. For example, in some places, states have moved forward with the creation of a long-term care social insurance. So we need to address the topic of funding, but again, we need to address it as a national imperative, and probably find ways to collaborate all together in securing these adequate funding sources, right? What you cannot leave it is to each one's pocket, right? Because our pockets are of different sizes, And if it is ultimately up to the size of your pocket, some people will be left out, for sure.
Absolutely. And kind of just along the same lines of, rights-based kind of, solutions and care, there's a question here from Tina Agrell, who asks, I know you mentioned as well, kind of having everything done at the national level to kind of actually have this change occur. But she asks, would a UN declaration on the rights of older persons help to prioritize direction of funds in all of these countries?
Well, that's actually a very interesting and it's not an easy question to answer, I must admit, because it has not been a topic of consensus. Okay? You have some advocating strongly for the implementation of a declaration of the rights of older persons. Again, very much in line with what happened with the Declaration of Rights of Persons with Disabilities, which one must recognize was a turning point in terms of the policy-making process and the development of how societies address disability. So one can imagine that the issuing of a similar convention focused on older persons could very well have the same impact. Some argue that the Declaration of Rights of Persons with Disabilities somehow already covers older
Mm.
persons as well. Others claim that if we are to fight ageism and the resilient use of age as a criterion, we should not have declarations of rights of older persons because older persons are citizens and their age does not define their rights as citizens. So those argued that the rights need to be addressed at, in a more general way and as issues of citizenship. So it's I mean it's possible to see merits in any of these
Mm.
understandings. Now, looking at this from a very practical perspective, so without going into more ideological discussions, and just based on what we have seen happening in other fields, when you have declarations, conventions, documents of strategy that somehow create, that bind national states and national governments to implement the required solutions to make sure that the principles that are included in those broad documents are in fact put in place, it does create pressure to
Mm.
make things moving. There are some interesting discussions in the academic literature about the way the policy-making process develops. And Mary Daly talks about the importance of naming and shaming to
Mm.
make things move. So one of the good things about having these references, be it a convention, be it a strategy, be it a declaration, is that you tend to set principles, then you tend to set targets, and once you set targets, you can measure what each country is achieving against those targets. And if you make that public, then you create some sorts of, it's like having a family photo. When we take a family photo, everybody puts on their best outfit because no one wants to look bad in the photo.
Yeah.
So sometimes these type of mechanisms are interesting to create that soft soft pressure that
Yeah.
you may look at it as soft, but it has to be quite effective sometimes in making things moving. In terms of the disability sector, it definitely made things move quite a lot.
A lot. Yeah, that's fascinating to kind of hear that perspective on that, and kind of just pushes people, challenges people, a little competition between countries to kind of push forward and say, oh,
Yep,
I'm
yep,
doing great over here. And
yep,
again,
definitely.
putting those like targets, for
Yep.
all those things. Yeah, I think that's really good to consider. Amazing. We have a question here from Eileen. I think it's specific to your research. Eileen, if you wanted to unmute and pose your question.
Thank you very much. Thank you very much, Dr. Lope. The question relates to any of your research include a table of the landscape, in particular within Europe, where there is statutory, where there might be statutory home care in the context of a national policy of having statutory nursing home care. In other words, the same care being provided in a nursing home, but it could be provided in the home. And what are the rights based on the rights of older people to the care?
Okay. Let me see if I understood well, but so it's like this: when you compare countries, when it comes to the menu of services they offer, things are actually quite similar across the world and definitely across Europe. You have these types of services. Now, you do have variation in how things are organized and what is included and what is not included in each of those services. For example, in countries where you have a very clear separation between healthcare and social care, often these nursing homes do not include the healthcare component. And for example, when talking with managers of nursing homes in some of those countries, one of the complaints we hear more often is precisely the difficulty that they are having more and more because of what I said earlier in my talk. We have people with increasingly complex needs, sometimes with very complex conditions in terms of health. And often nursing homes do not include the healthcare component in some countries. And because these things are then related to rules of funding, it becomes quite difficult for the care provider to secure good quality of care, because there are dimensions that are literally impossible to tackle. So there is a lot of variation, I would say, not so much in the typology of services, because this tends to be more or less the same across all countries, but what they actually entail, what they involve, and in material terms, what is the service that is provided within each, it varies a lot across countries.
Yeah. I hope that answers your question, Eileen. Thank you for posing.
Not sure if I understood it well, but
Yeah.
please, if not,
Yeah,
I
no,
can elaborate.
just for clarification,
Mm-hmm.
A lot of people want the same rights and services in a home situation as distinct
Okay.
from in a physical building.
Okay,
Um,
okay.
And is there any table? Because we're in Ireland, we're thinking of doing that, but there's a lot of drafting and talking, but no action as yet.
Look, I think that, okay, I'm sorry because I didn't understand well the question, my mistake. I think that the topic you raised is very, very important because it relates to the idea of care continuum, okay? At the end of the day, and looking at this from a person-centered perspective, at the end of the day, what is important is that you secure the care each individual needs and prefers as well. Okay, because if we are talking about rights, we need to accept that it's important to recognize the role of preferences, individual preferences. But at the end of the day, what is important is that you secure the care the person needs based on their unique needs. Okay, so you must start from assessing needs, and from there move to allocating the adequate care. Now, it is true, and survey data across the world points systematically in that direction. People want to stay home if they can. Okay. It's not even an issue for debate. If possible, people want to stay home, and that's why there has been so much emphasis on developing home-based, community-based services to secure that people can indeed age in place. And in a very wide set of scenarios, this is actually even the most affordable way to provide care, because home-based care typically is less expensive than institutional care. Now, we also need to understand, and going back to the idea of care continuum, that when you move to a person-centered approach, and if you put the needs of the person at the center, this means that you need to have the flexibility to also move along different types of services, because needs are not static, needs are dynamic, needs change. Okay, and some complex needs, namely in terms of healthcare, it may not be possible to secure that type of complex care at home, or it may just not be cost effective to secure that care at home. So you may have to transition across different types of services, and that's why it's important to think about the way we organize the long-term care system as a whole along this idea of care continuum, because people will transition along different types of services, and it's not necessarily a linear transition. Okay, so it can go back and forth up to the very end, where sometimes, for example, the transition to palliative care, which is something that we also don't discuss much, but that is part of long-term care as well.
Thank you. I know we're kind of running low on time, so I'm going to try my best to, I know there's a lot of comments and questions, which is fantastic. Everyone is excited about this topic, which I love. I just want to point out, Mark Venning has posted 2 sources in the chat that are specific to Canada, if some people wanted to take a look at that. I also wanted to acknowledge some comments from Dr. Asha Rao. I know she mentioned one comment here where she mentions that government policies tend to be more effective for children and those who are younger, as they're, later become more of the earners, or, the workers kind of driving the economy in a country. So I feel like there's that bit of that ageist kind of mentality of a lot of like maybe national governments that might be involved.
Yeah.
Wanted to speak on that?
And this is where a social investment perspective can go a long way. That's precisely the type of discussion we were trying to develop in that project you mentioned earlier when introducing me, the Sprint project. Because, you're quite right. There is this, you can see it as an ageist tendency to associate care for older persons to this notion of burden. It's a burden. It's a source of costs with no returns. And when you think about childcare, it's the other way around. It's an investment because you can think about the returns. Now, I think it is definitely something we need to address, and because it's a misconception. Okay, investing in long-term care can be actually investing with huge returns. Think about, for example, the value or the size when you look at long-term care and you look at informal carers. I don't know if you have an idea about how much they represent in terms of the EU GDP, but estimates published in the literature, of course, you can always question the models that are used to come up with those estimates, but that's a different conversation. But estimates suggest that the work of informal carers can amount to 2.5% of the GDP.
Mm.
Now, keep in mind that, for example, not supplying adequate and sufficient long-term care means that many individuals, and among those, let's be very honest, mostly women, have to drop out from the labor market or engage in part-time work to be able to juggle, the responsibilities of becoming a carer of an older parent, for example. And this has costs. This has costs not only for the individuals. I was here remembering a recent piece that was published and that tried to estimate precisely the loss of net income, the average loss of net income for women in the age group of 45, 64, which is the group that tends to absorb more responsibilities for taking care of older persons. And the estimate was around a net loss of 17,000 euros, okay, annual income lost. So this hurts people, this hurts individuals, namely the carers, loss of income, which then has prolonged effects over time, namely it will hurt their pension entitlements, it will increase the risk of poverty in these groups. But by removing people from the labor market, you also have negative effects for the entire economy, for the society as a whole. Less taxes being paid, you lower the consumption of the capacity to the purchase power of these individuals. So you hurt consumption. So you have to think, a bit outside that narrow box and look at investments in long-term care as actual investments, even from a purely economic perspective. Okay, even if you just want to look at this, looking at the economics, it's not a cost. Okay, it's an investment. Okay, similar to what happens with childcare.
Yeah, absolutely. And I think even there was a comment in the chat that kind of along the lines of investment, having educational programs for carers themselves, continuing along the lines and addressing those challenges that you mentioned earlier. I think that's like just it's something to keep in mind. This is an important investment, and something we should, not, just push aside just because we have some misnotions about long-term care and older adults. Absolutely.
True.
So we are kind of at the coming close to the end of our hour. I really wish we could address a lot of the questions and comments that are coming in the chat because they are really quite excellent, and I hope everyone has had an incredible session today. But before we wrap up, I would love to hear your key takeaways from today's discussion, Dr. Lopez. So I'll give you a little time to just gather your thoughts as I will introduce our next week's topic and speaker right now. So please join our discussion next week with Dr. Tazim Virani on the topic of ageism in the workplace. So please join us to listen to that great discussion next week. And just as a reminder, I believe Eileen mentioned that actually in the beginning of our chat, we will be running on Eastern Daylight Savings Time. So if there's a time change in your region, just keep note of that and have that adjusted in your calendars so that you don't miss the session for the next couple of months. So now we're back to you, Dr. Lopez. In a few sentences, what are some
Yep.
of your key takeaways from our conversation that you would love for us to all leave with today?
Okay, so let's try. So I think it's quite clear for everybody nowadays that this is no longer a topic that can remain invisible as it was when I first started working on this issue. It is important to acknowledge that the aging of the population is a great thing, but it comes with some challenges, and definitely the aging of the population means that we are going to witness a steady increase in the demand for long-term care. Okay, so we need to find ways to tackle this demand. Now, let's not forget, and it was an issue that I only touched briefly, and I think it's important as a take-home message, that there is also a lot to be done in terms of decreasing this demand. Okay, so don't forget the importance of promoting healthy aging. It is definitely the best investment to decrease the demand for long-term care. Okay? But looking specifically at long-term care, we need to embrace it as a mission. It's a mission for everybody. Okay, hopefully we will all age, so hopefully we will all have time in our life to be confronted with this problem. We don't want to have losses in our health when we grow older, but hopefully we will grow older, and the chances that we will experience this are high. So it is a matter for everybody. So we need to embrace it as a mission. But while doing that, we also need to embrace the idea that long-term care needs to be something for all. We cannot leave some out. Okay? No one can be left behind. So this means that we need to sit and discuss how are we going to organize ourselves as countries, as communities, to secure adequate, affordable, and high quality long-term care for everybody. It is a question of fundamental rights, as I see it, whether we are going to go in the direction of having a convention or a declaration of rights. I don't know if that is the way, but definitely we are talking about fundamental rights, the right to age and live with dignity, the right to enjoy a life that is fulfilling, a life that makes you, at the end of the day, happy. So I think this is the key message to take home, and what I would like to emphasize.
I think that's such a beautiful way to kind of end this conversation. So well put with everything that you've mentioned, and love how you've drawn on kind of all the main challenges, the solutions, the options, and the positive forward thinking that we need to have kind of going forward just across the world. I think that would be fantastic to have. So thank you so much, Dr. Lopez. Before we
My pleasure.
sign off, I would like to thank again everyone for another great week of our Global Cafe sessions, with special thanks again to Dr. Alexandra Lopez for joining us today. Great thanks to the incredible people working at the IFA who have supported this and every Global Cafe, in particular, Ms. Luana Colnago. So thank you, everyone. We hope to see you all next Friday. Wish everyone a great weekend. Take care and thank you so much.
Thank you and see you.